If you have ankylosing spondylitis, you've likely heard about the non-starch diet. It's one of the most debated topics in the ankylosing spondylosis community. As a surgeon, I see the end stage results of this disease, so I want to help you understand if changing your plate can actually protect your spine. Hi, I'm Dr. Jayesh Bhanushali. Today we are going to talk about the no-starch diet for Ankspond and does it actually work. Ankylosing spondylitis isn't just your back pain, it's an autoimmune attack. Your body mistakenly identifies your own joint, specifically where your tendons meet the bones, as an enemy. The result is constant inflammation. Over time, your body tries to heal that inflammation by growing new bones on it. This is how the spine eventually fuses together. You feel stiff, exhausted, and stuck. Most patients feel like they are on a one-way track towards biologics or surgery, and they want a way to fight back naturally. The theory behind the no-starch diet, often called the London Ankspond diet, is based on specific gut bacteria called Klebsiella. The idea is that Klebsiella feeds on undigested starch in your large intestine. When these bacteria multiply, your immune system reacts because of a genetic marker called HLA-B27, which many Ankspond patients have. Your immune system gets confused and attacks your spine instead of just the bacteria. This creates a terrifying cycle. You eat a potato or a slice of bread, the bacteria throw a party in your gut, and your spine pays the price the next morning with unbearable stiffness. For many, this makes every meal feel like a gamble. Now, does it actually work? The honest answer is maybe. It's a game changer for some people, but for others it doesn't change a thing. Why it helps some people? When some patients stop eating starchy foods like bread, potatoes and pasta, the inflammation in their body drops. We can actually see this in your blood test through markers called CRP and ESR. If your gut is sensitive, starch might be feeding the inflammation that makes your spine stiff. If cutting it out works, you'll find yourself needing fewer painkillers. Now, why does it fail for others? For many people, the diet does nothing because their ankylosing spondylitis is driven by genetic stress or lack of sleep rather than what they eat. You could eat the perfect diet and still have a flare-up because your DNA is the primary driver of the inflammation, not dinner. Here's the safe way to find out if no-starch diet is working for you. You can do a 30-day experiment. Don't guess or wonder. Cut out all the starch for 1 month and keep a simple log of how stiff you feel in the morning. If you don't feel significantly better after 30 days, starch probably isn't your problem and you can go back to eating it. Second, changing how you eat is a great tool, but it doesn't always replace medicine. The main goal is to stop your spine from fusing together. If the diet helps, that's a win. If it doesn't, we use modern medicine to do the heavy lifting. Third, now whether you eat starch or not, focus on firefighting foods like salmon, which has omega-3s, and colorful veggies that help calm your system down. If you found this breakdown helpful, make sure you hit that subscribe button and click the notification bell. Dealing with ankylosing spondylitis is a long journey, and my goal is to give you the tool to take control of your spinal health. If you've tried the no-starch diet, drop a comment below. I want to know if it worked for you or if it was just a struggle. Your experience could help someone else who is hurting today. That's all for today. I'm Jayesh Bhanushali, your spine surgeon, signing off, and I'll see you in the next one.